The last subtype of fibromyalgia I'd like to talk about is iatrogenic fibromyalgia. Iatrogenic fibromyalgia means that it's being caused by a medication. It's being caused by some form of intervention. So I had two cases where this came up, but I want to talk about George, 52-year-old, came to me with the diagnosis of fibromyalgia. He wanted treatment. I examined him. He did meet the 11 out of 18 tender points consistent with the diagnosis of fibromyalgia. But as I was taking his history, I found out he had a history of hyperlipidemia or high cholesterol. And what was striking is that shortly after his primary care doctor had put him on a statin drug, his symptoms began. Statin drugs inhibit an enzyme, and that's how they lower the cholesterol. Unfortunately, they also block CoQ10, which is a very, very important antioxidant in the body. And what can happen as a result of that blockage is, wonder of wonders, muscle pain. In fact, in one subtype of patients, genetically vulnerable patients, a statin drug can cause tissue necrosis. It can actually cause muscle to break down in a very dramatic and severe way. But in this case, the timing of being put on the statin drug and the onset of the fibromyalgia symptoms was so direct and so obvious that I told the patient, you got to get off that medication immediately, which he did. And I got a call months later saying, thank you very much, I have no more pain, bye-bye. So that's one case of a patient that had fibromyalgia that was caused by medical treatment. The more enlightened doctors that use statin drugs will put patients on CoQ10 to try to prevent something like that from happening. Thank you.